Hi guys, Dr. Shaun here. So today we're going to be talking about some signs that your patient may need a root canal. So the following are going to be a list of some of the most common signs and symptoms that a patient may need a root canal when they come into your office. Pain is the most common sign that a patient may need a root canal. When they come into your office, they can have either dull pain, they can have sharp pain, they can also have spontaneous pain. What I really like to test is if they have any kind of triggered pain. So either pain from hot or cold, or when they eat sweets. The rule of thumb is that if the stimulus is applied and the patient's pain just lasts for a few seconds, then it's usually something that's reversible. But if the pain lasts for more than 30 seconds after the stimulus is removed, then that's usually a definite sign that there's something going on with the nerve of the tooth and the patient needs a root canal. So pain is the most common symptom. Another sign that your patient may need a root canal is that they come into your office with a broken tooth. Now obviously it depends on how badly the tooth is broken, but for example, if they come in and you take a look and you see that the nerve is exposed, then that's usually a good sign that the patient needs a root canal. If the nerve is not exposed, then you can do some testing on the tooth to see and test the nerve and see how the nerve responds. But usually if the tooth is broken down to the point where the nerve is exposed, then the tooth definitely needs some sort of root canal. So some other signs and symptoms, kind of talked about it before, but sensitivity to hot and cold or sweets. So a lot of patients come in just on an emergency basis saying, I have sensitivity in this area to hot or cold, or when I had sweets. Usually, for the most case, it's something that's reversible. They either have quite a bit of recession on a tooth, and it's just the root being very sensitive. But once in a while, it's to the point where if they do have hot or cold or anything sweet, the pain lingers to the point where it's over about 30 seconds, then it definitely needs a root canal. So in terms of sensitivity to liquids or food, it all depends on how long that pain lasts after they have that liquid or food. So again, if it lasts less than 30 seconds, most likely you probably don't need a root canal, it just needs some kind of other restoration. But if it lasts more than 30 seconds, then we're probably looking at a root canal. So the next sign would be some sort of bump or abscess on the patient's gum area. So a patient will come in, they say, I have this bump-like protrusion on my gum area near my tooth. So whenever I see some sort of bump like that near the gum area of a tooth, it's usually filled with some sort of pus, meaning that it is some sort of infection. So what I do from then is just go ahead, take a periapical x-ray, and lo and behold, usually we see a little bit of radiolucency around the root area. And that's basically a sign there's an infection, and the patient definitely is in store for a root canal. And the last sign that a patient may need a root canal is if they have some sort of deep decay. So a lot of times patients will come in, they have no pain, they have no sensitivity, but I'll take some x-rays and do an exam, and I'll see a really deep cavity or existing filling or crown that has some recurrent decay, and it's so deep that it's pretty close to the nerve, but it hasn't extended to the nerve yet, so the patient's not really feeling anything, but it's basically a preventative measure. What we have to do in that case is we probably have to either test the tooth ourselves or refer them to an endodontist so they can test the tooth to make sure that that nerve is responding correctly. If it's not responding correctly, then that's a sign that the patient may need a root canal. So these are some of the most common signs or symptoms that a patient needs a root canal when they come into the office. But this is why I really reiterate that it's so important that you come in for your biannual checkups and cleanings, because all these signs that the patient comes in with, they could have been found earlier, and everything could have been fixed. So it's really important that you get into your office every 6 months at least, so the doctor can check you out. Well, I'm Dr. Shaun. Thanks for listening. Have a great day.